Unlike many other diseases, lung cancer has a major PR problem, being so closely associated with smoking. This association has long been a barrier when attempting to attract research funds. But, as CBC Health reporter Pauline Dakin discovers, Canadian researchers are plowing ahead, developing new groundbreaking screening tests to better detect the forgotten cancer.
Lung cancer doesn't get the same support and attention as many other cancers, even though it kills more Canadians than breast, prostate, and colon cancers combined. But there is a glimmer of good news, progress with new treatments and ways of detecting it sooner.
I'll have a little more coffee, please.
Arthur Smith is really enjoying his coffee and everything else about life these days. He's one of 9 people across the country who've had very early stage lung cancer tumors detected as part of a clinical trial.
He's very unusual. We don't usually pick this disease up at a very early stage.
Dr. Michael Johnson is the surgeon who removed Smith's cancer and one of the researchers testing a new strategy for the early detection of lung cancer in cities across the country. If Arthur is unusual, so is the trial. Like some other lung cancer screening trials underway in the U.S. and Europe, this trial is using CT scans. But lead investigator Dr. Stephen Lamb at the BC Cancer Agency says a CT scan isn't enough.
Although it's very sensitive, its downside is we also pick up little things that are not cancerous.
So Lamb, Johnson, and the other Canadian investigators are also using other tools to help predict and pinpoint lung cancer, including second CT scans to look for changes and autofluorescence bronchoscopy, a scope to look at patients' airways. For patients like Arthur Smith, it's meant a cure for a disease he didn't even know he had.
I think I've got a long life ahead of me yet.
A long, healthy life. Pauline Dakin, CBC News, Canning, Nova Scotia.
Grâce à une subvention des Instituts de recherche en santé du Canada, Pauline Dakin est l'une des premières journalistes à recevoir des ressources supplémentaires pour appuyer sa recherche sur cet enjeu critique.